Hello, my name is Dr. Dewan S. Raja. Today I will discuss about anatomy and physiology of the suprarenal glands, also called adrenal glands. These are triangular shaped glands located on the top of each kidney. They are vital endocrine glands and are responsible for producing hormones that regulate various physiological processes. Each gland is divided into two main parts, the cortex and the medulla. We have to remember that the adrenal or suprarenal gland are on the top of the kidney. They are separated by fibrous tissue. So embryologically and functionally, they are not same as the kidney. They are different organs. The endocrine glands, they are just on the top of kidney as close proximity by the fibrous tissue. Location of the suprarenal glands. The suprarenal glands sit on the superior pole of each kidney in the retroperitoneal space. Shape. The right gland is more pyramid shaped, whereas the left gland is more crescent shaped. Each gland is about 5 centimeter in length, 2.5 centimeter in width, and weighs about 5 to 7 grams. The suprarenal cortex is the outer, thicker portion of the gland and makes up about 80 to 90% of gland. This is responsible for producing steroid hormone. The cortex is divided into three zones. Number one, zona glomerulosa, the outermost. Then the middle layer is the zona fasciculata, and the inner layer close to the medulla is the zona reticularis, is producing different hormone. Zona glomerulosa outer layer function secretes mineralocorticoid, mainly aldosterone. Role of aldosterone. Aldosterone regulates sodium and potassium balance and blood pressure by controlling the reabsorption of sodium in the kidneys. Suprarenal gland, second layer of the cortex, middle layer, its function to produce glucocorticoid, primarily cortisol. Role. Cortisol influences metabolism by promoting glucose production, fat breakdown, and protein metabolism. It also plays a key role in the body's response to stress and helps regulate immune function. Zona reticularis, inner layer, function secretes androgen, including dehydroepiandrosterone. Role. Androgen contribute to the development of secondary sexual characteristic and have some effect on libido. It increases libido. In female, adrenal androgens are a major source of these hormones. Suprarenal gland, the suprarenal medulla. The medulla is the inner part of the gland. It is surrounded by the cortex. It functions as part of sympathetic nervous system and is responsible for the secretion of catecholamines. The cells of the medulla are specialized chromaffin cells, which are modified postganglionic sympathetic neurons. Okay, this is the image from Gray's Atlas of Anatomy. We have to find out the suprarenal gland. This is the left suprarenal gland. This is the right suprarenal gland. This is triangle. This is pyramidal shape. This is crescent shape. And if we go to the blood supply, suprarenal gland has very rich blood supply from the superior suprarenal arteries, the branches of the inferior phrenic artery. Middle suprarenal artery is a branch of the abdominal aorta. Inferior suprarenal artery is a branch of the renal artery. Okay. Venous drainage on the left side, it goes to the left renal vein. On the right side, it goes to the inferior vena cava. So this is the image from Guyton's Physiology. You have the cortex. This is the medulla. Cortex has three layers. Zona glomerulosa, it produces aldosterone. Zona fasciculata secretes cortisol mostly, and little part androgen, little contribution. But the zona reticularis for the androgens. Zona medullaris, catecholamine like epinephrine, norepinephrine. This is the histological image of the medulla, image of the cortex, zona glomerulosa, zona fasciculata, zona reticularis. This is the medulla of the suprarenal gland, and this is the histological appearance. Catecholamine epinephrine, that is from the medulla, increases the heart rate, dilates bronchi, promotes the breakdown of glycogen to glucose, enhancing body's fight or flight response. Norepinephrine, noradrenaline primarily affect vasoconstriction, increasing blood pressure and peripheral resistance. Role: the medulla plays a crucial role in the short-term stress response by preparing body for physical exertion and rapid response to stressful situations. Okay, we discussed the arterial supply, venous drainage, nerve supply. The adrenal medulla is innervated by the preganglionic sympathetic fiber from the splanchnic nerves. These nerves stimulate the release of catecholamine into the bloodstream during stress. Summary of suprarenal gland, adrenal gland. Cortex produces hormone essential for metabolism like cortisol, electrolyte balance like aldosterone, sexual development like androgen. Okay, cortisol is coming mostly from the zona fasciculata, aldosterone is coming from zona glomerulosa, and androgen is coming from the zona fasciculata. Medulla secretes hormones that are crucial in the body's they are crucial in the body's response to stress, epinephrine and norepinephrine. The suprarenal glands are essential for maintaining homeostasis, regulating metabolism, blood pressure, immune response, and reacting to stress. And that's all about the anatomy and physiology of the suprarenal gland, also called adrenal gland. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.